Good day, my name is Jumaine Ruiz, and I'm here to provide an in-depth discussion about the trigeminal nerve. To start us off, we have to read out the learning objectives that I have provided for this topic of the day. The objectives: being able to distinguish the branches of the trigeminal nerve by memorizing the origin, distribution, and function of each branch. Being able to examine the innervational structures of the face and oral cavity by tracing the pathway and terminal branches of the trigeminal nerve. So, in short, we are to familiarize ourselves with the trigeminal nerve, identify its importance and its purpose. So, to start us off, what is the trigeminal nerve? So, for us here in the field of dentistry, a trigeminal nerve affects the influences our management of procedures involving the oral cavity and associated structures. This discussion will deal with the areas innervated by its branches. So to start us off, we have more of a to answer the question, what is the trigeminal nerve? We have here on the screen a more accurate meaning of what the trigeminal nerve is. Okay, the trigeminal nerve, also known as the fifth cranial nerve or CNV for cranial nerve 5, is a nerve responsible for sensation in the face and motor functions such as biting and chewing. It is the most complex of the cranial nerves. And why is that? That's because the cranial nerve has intricate nerving systems in the face, and it's the most complex nerving system in the human body. So discussing the etymology or the origin of the word trigeminal nerve, its name trigeminal, meaning 3, derives from the fact that each of the 2 nerves has 3 major branches. These 3 major branches are the star of the topic for the day. And to proceed, these 3 major branches are namely ophthalmic nerve, and the maxillary nerve, and lastly the mandibular nerve. These 3 are known to be the major branches of the trigeminal nerve. And for our topic and for the discussion for the day, we're going to start off with the ophthalmic nerve. So, the ophthalmic nerve, as I've discussed, is a branch of the trigeminal nerve. It is the most superior branch of the trigeminal ganglion and is exclusively sensory, meaning it supplies sensory innervations to certain parts of the body, which I will discuss in a bit. First off, we shall talk about the branches of the ophthalmic nerve. So it's funny how the trigeminal nerve has its branches, while its branches also has its branches. So to further into the topic, within the ophthalmic nerve, we have 3 branches: the frontal, nasociliary, and lastly the lacrimal. So first off, we have the lacrimal, this thin part here. It is the thinnest branch of the ophthalmic nerve. Next, we have the frontal. It is stated as the middlemost branch, which is also the thickest of the 3 branches. And lastly, we have the nasociliary nerve. It is the medial terminal branch of the 3. So these are the 3 branches of the ophthalmic nerve. Next, we are to discuss about the origin of the ophthalmic nerve. So the origin meaning the place where it came from. That place being the trigeminal ganglion, and like all the other branches of the trigeminal nerve, they all came from the trigeminal ganglion. Next, we have the cranial exit. The cranial exit, which I'll discuss as the superior orbital fissures. Superior orbital fissure is located behind the eyeball. It is where the ophthalmic nerve leaves the cranium. Next, we have the innervation, the ophthalmic nerve's innervation, or its nerve supply, blood supply, or all that. We have here the green zone represents the places that are innervated by the ophthalmic nerve. So we can name a few. We have here the dorsum of the nose, the eyeball, the eyelids, the forehead, the upper scalp, and there are many more that the ophthalmic nerve innervates, which are underlying the skin. That's mostly it for the ophthalmic nerve. And next we have is the maxillary nerve. So, for our second branch of the trigeminal nerve, we have the maxillary nerve. Like the ophthalmic nerve, it's exclusively sensory, innervating through certain parts of the face. So let's head on to the discussion. We have the branches. As you can see here, there are a lot of different branches to name within the maxillary nerve. But we are only here to identify the few major branches within the maxillary nerve, which are the meningeal nerve, branches of the spinopalatine ganglion, otherwise known as there are actually 4 branches within the spinopalatine ganglion: the orbital, the nasal, pharyngeal, and lastly the palatine. So next we have the zygomatic nerve, the PSAN, or the posterior superior superior alveolar nerve. Then we have the infraorbital nerve, which contains the middle superior alveolar nerve and the anterior superior alveolar nerve. So that's all we have for the branches part. Next we have the origin. So as I've discussed in the ophthalmic nerve, that all of the major branches of the trigeminal nerve originates from the trigeminal ganglion. So as I've said, so the maxillary nerve's origin is the same as the ophthalmic nerve's origin, as presented here in the presentation is the trigeminal ganglion. Next, we have the cranial exit. The cranial exit is the pathway or a way where the nerve leaves the cranium. We have here for the maxillary nerve is the foramen rotundum. The foramen rotundum is a circular hole in the sphenoid bone. So that's mostly it for the cranial exit. Lastly, we have the innervation. And for the innervation, we have here the maxillary nerve represented by the red area here. So we can actually name a few here. To name a few, we have the upper jaw, the cheeks, the nasal cavity, and the palate, and so many more, but it's too hard to discuss. So that's about it for the maxillary nerve. Next, we have the last branch, the mandibular nerve. The last branch for today, it is the third and largest nerve branch among the 3 trigeminal nerves. It has both sensory and motor function. As always, to start us off, we have branches: the sublingual nerve, the inferior alveolar nerve, and the auriculotemporal region. The sublingual nerve situated here below the inside the mandible. The inferior alveolar nerve situated here at the posterior part of the mandible. And lastly, the auriculotemporal region near the temporal region and near the otic division. So the next we have is the origin. The origin, as always, it's the same as the other 2. We have the trigeminal ganglion. So next, the cranial nerve. For the cranial nerve, we have here is the foramen ovale. So for the mandibular nerve's cranial exit, it's the foramen ovale. It is a much larger hole compared to the foramen rotundum of the maxillary nerve, and is on the posterior part of the sphenoid bone. Next we have, it's located here, this one. Next we have is the innervation, yes, and the last innervation for the discussion. So we have here, represented by the blue or purplish zone here, is the innervations of the mandibular Oops. Mandibular nerve. So, to name a few places where the mandibular nerve innervates, we have here the lower teeth, the lower lips, the chin, the a part of the ear, and I could go on, but that should give you a vague idea as to what the mandibular nerve innervates here, mostly this part here. So, wrapping things up. So, that basically wraps the mandibular nerve branch. Next, let's proceed to the conclusion of the discussion. So, wrapping things up, I have prepared here a short summary of what we've discussed for today. So, the trigeminal nerve is the largest nerve of the 12 cranial nerves, and as we've discussed, there are three different divisions, or as we discussed, three different branches of the trigeminal nerve, namely the ophthalmic nerve, the first nerve, then the second nerve, the maxillary nerve, and lastly the third nerve, the largest one too, the mandibular nerve. So basically, we discussed about the importance also. Basically, the trigeminal nerve transmits sensory information to various areas of the face. As a future dental practitioner, I have to become aware of the trigeminal nerve because as we, as dentists, mainly uh, do procedures within the oral cavity. One small mistake may cost us our careers. So that's about it for the discussion for today. Once again, my name is Jumaine Evan Ruiz, advising you to stay healthy, stay safe within the ongoing pandemic, wear your mask, and drink lots of water. Thank you very much for listening to me, and goodbye.